Hey, billing and coding experts and health benefit plan administrators. I'm Dr. Ellen Fitzenreiter, and I want to talk to you a little bit about shenanigans and accountability from insurance carriers. But first, I want you to understand, whose money is it anyway? Did you know that in most states, a single carrier is responsible for the processing of the majority of all health insurance claims? Check out this AMA PDF and look at the tables. Go ahead, screenshot it. It's important for you to realize that when you see a logo on someone's insurance card, it doesn't mean that that patient has insurance directly with that insurance carrier. In fact, over 60% of the time, they don't. Let me show you. For example, in Virginia, Anthem Blue Cross Blue Shield is just a third-party administrator for a majority of the claims that they process. Depending on the geographic location of the provider, each office has their own unique patient demographic, and therefore the primary carrier processes claims for different self-funded entities as well as their own insureds. The Virginia State Corporation Commission Bureau of Insurance only has authority over actual Anthem insureds, and in the case of most offices, this is a very small percentage of their patients. When I was practicing, it turns out that only 1% of my patients actually fell under the jurisdiction of this Virginia government entity and was able to respond if I had a problem. And I had big problems. In fact, over 100 chiropractors had big problems. Claims are paid by, and the money belongs to, those contracting entities and not the carrier. There is no state authority keeping an eye on insurance carrier third-party administrator activity. The Virginia Department of Human Resource Management? No one is watching their backs. The federal OPM? Nope. Self-funded and self-insured entities? They fall under the jurisdiction of the Federal Department of Labor and ERISA. Out-of-state entities? They're on their own. I'm not talking about identifying and correcting legitimate billing and coding errors or electronic filing issues. I'm talking about ridiculous denials and non-responsive provider representatives to help resolve persistent problems, and activity that, I'm just going to say, seems like something's just not right. I am planting a seed with you today that accountability must come by involving the self-funded entities that a carrier contracts with. After all, it is a contract, and the carrier, as a third-party administrator, is supposed to be doing a good job and processing claims accurately. When they're not, and if it impacts insured's access to the benefits they are paying for, that's a big problem.